A new report funded by the State Department paints a dire picture of the humanitarian situation in Darfur in western Sudan. Nearly 5 months ago, the Sudanese military and Insurgent Rapid Support Forces, or RSF, started fighting each other for power. The UN says at least 4,000 people have died. Violence quickly spilled into Darfur, where elements of the RSF were accused of genocide 20 years ago. As Nick Schifrin reports, history appears to be repeating itself.
The aftermath of airstrikes, the echo of gunfire, and the frightening flames of civil war have engulfed Sudan's cities. Just last week in the capital Khartoum, a massive fire burned near the airport. There's no safety for the living and no dignity for the dead. Civilians are dying so quickly, graves are left unmarked. And now the power struggle between Sudan's armed forces and the Rapid Support Forces, or RSF, has reignited ethnic conflict in Darfur, a western region the size of Spain.
It is ethnic cleansing, and it is ethnic cleansing that right now is occurring.
Nathaniel Raymond is the executive director of the Humanitarian Research Lab at the Yale School of Public Health. His team works on the State Department-funded Sudan Conflict Observatory to expose the atrocities of war that might otherwise go unreported.
Cell phone connectivity and internet connectivity has been knocked out, in some cases intentionally, as we've documented, by the RSF. And so our work is, unfortunately, the only game in town, in many cases, to be able to corroborate what's actually happening. And that's done through a combination of satellite imagery, open source reporting, and also thermal sensors from NASA.
Their new report from Darfur's largest city, Nyala, shows damage to a market, a mosque, a military hospital, and a prison. Last week, a local journalist from Nyala posted these photos of what appear to be a single incident where dozens died. We spoke to one of the victims who survived. Mahala Adam has now fled to East Darfur.
A little girl called Huda, her face was split down the middle. Another neighbor's head was severed. I started screaming when I saw my aunt's head had exploded. I kept screaming for help. My aunt's family has been torn apart. I passed out. That's the last thing I remember. No one came to help. No government, no military, no rapid support forces. Absolutely no one came.
We have seen an alleged massacre of almost 30 people, including from 5 families at the Teba Bridge, reportedly, where they were killed by a stray missile. And so the situation is that both forces are now moving into civilian areas, occupying civilian homes, and firing at each other in close proximity. In the middle of this battle are civilians.
Do you believe exposing what's happening can protect the people on the ground?
At this point, we are conducting early warning that turns into autopsies. We are trying to warn, and when the warning goes unheeded, we are trying to document the destruction of entire communities.
In the 2000s, government-backed Janjaweed militias in Darfur brutally crushed an uprising and killed hundreds of thousands of non-Arabs. The Janjaweed gave birth to the RSF, which today, with other Arab militias in the same place, is behind the new violence in Darfur.
We are concerned that Nyala is a preview, is a coming attraction of what happens next. We are talking hundreds of thousands of people, the most vulnerable people on the planet, who have really, at this point, no protection force between them and RSF, which has clearly shown, like the Janjaweed from which they are descended, that their intent is to liquidate, prioritizing men, but also with sexual gender-based violence against women, to liquidate non-Arab people in Darfur.
And the violence has targeted Sudan's healers. As many as 3/4 of healthcare facilities have been destroyed. Dr. Yasser Alamin is president of the Sudanese American Physicians Association.
The situation in Sudan in terms of healthcare is in near a complete collapse. The majority of hospitals and healthcare centers are out of service. In Khartoum, the capital, where most of the healthcare services are concentrated to begin with. And that's also the case in Darfur, the west of the country, What that means is, people who get injured as a result of the war, they don't get the care that they need. And those who get other medical conditions, whether heart attacks, whether need their diabetes to be managed, a woman wants to deliver, a kid who needed vaccination, all these services are mostly non-functional now. In Sudanese social media groups, people are exchanging tips on how you can deliver a woman at home. So it's in a very, very bad situation.
The international community has said that it is getting supplies into the country, more today than they were a few months ago. But are those supplies reaching hospitals? Are they reaching the people who need them?
The situation has improved, as you point out, but it continues to be terrible in the sense that there is a mismatch between what's actually delivered to Port Sudan, which is the key port to the country, and what's actually delivered to the end user. And this is due to safety reasons, so it's not safe to move stuff around most of the country, and also due to a non-functional government that is incapable of delivering aid to those who need it most. And finally, also, I think the international aid agency, whether the American, whether the UN ones, have been really reluctant for so many reasons to work with the local community.
Let's zoom into Darfur. You're opening up a new clinic on the border between West Darfur and Chad. What's the humanitarian situation there?
Hundreds of thousands have left Darfur, went to Chad. The situation there is particularly tough because it's taken this ethnic flavor to it, and it's kind of tragic in the sense that the RSF was formed originally to help it suppress the rebellion in Darfur, and now it turns against the army. But the bottom line, the RSF was trained not to respect human rights, to kill on basis of ethnicity, and to use sexual violence as well. And that has been really seen mostly in Darfur, where there are kind of very credible reports that there has been killing based on ethnicity, there has been indiscriminate killing of civilians. In El Geneina, the capital of West Darfur, basically you have no healthcare services.
And you mentioned sexual violence. Is that one of the most brutal aspects of this conflict?
Absolutely. So, you know, Sudan has known sexual violence as a tool in war. Last week there were reports of women being sold. So we're seeing certainly kind of a resurrection with these crimes that we've seen in the past in Darfur.
We've been interviewing people in Darfur, and they describe these harrowing scenes of the wounded not being able to reach the hospitals and dying on the way, and exactly what you said before, people who need routine medical care simply unable to get it and dying for that reason. Overall, the level of crisis there seems like it's getting worse.
Absolutely, it's getting worse. As I said, you have west of Darfur, no healthcare services. Now the violence has spread to South Darfur, Niala. The bombing has included also other different parts of Darfur. So it's I think in Darfur in particular, the worst is yet to come. Because I think the social fabric there, in Khartoum, you have the RSF and the army fighting, but in Darfur, I do think that we are seeing evidence that's now spread into the larger society, ethnic tensions in Darfur, that can, you know, open the door to widespread violence.
There are about to be as many as 5 million people displaced. How much of a threat is that massive number to the country and to the region?
First of all, this is creating a difficult security situation within Sudan itself. It's putting pressure on all the services in other cities that are not equipped to deal with these large numbers. And overall, I think if the war escalates and we see people leaving Sudan and the country disintegrates, I think it's going to have a huge impact across the continent, which is already suffering a lot from multiple wars.
Dr. Yasser El-Amin, president of the Sudanese American Physicians Association, thank you very much.
Thanks for having me.